I'm Dennis Godby, a naturopathic doctor in Sacramento, California. Well, naturopathic medicine is really about nature cure. It's really identifying and treating the cause, using prevention, doing no harm, and really using natural remedies to treat the cause. In California and other states, 15 other states, we're licensed as primary care doctors, and I think that it's a good idea to have a medical doctor as part of your system of overall care. They do things that we don't do. But I really believe that we're the first, should be the first option rather than the last resort. Most people come to us after their doctor can't figure out what's going on. And through our blood testing and through all of the various tests we do, hundreds of different tests that they don't do, we're able to find and treat the cause and use natural remedies rather than pharmaceutical drugs and other things that could really endanger, like hyperthyroidism, taking out the thyroid, many things that don't need to be done if we would use natural remedies. Oftentimes we think of medicine as just the absence of disease. We want to go to doctors so that we'd be free of disease or to treat a disease we already have. Prevention really means don't have a bad thing. Don't have a disease, don't have diabetes. We don't want people to not have a disease. We want people to have as much energy and vitality and hope and quest for life as they can, and inspired, and that comes from having energy and having your mitochondria or your cells of your body working well. And what we're really looking for is how do we help people to attain optimal health. And when people don't come in frequently to get their blood testing, there could be a lot of things going on that they're not aware of. And so it's really, really important that we're able to spend the time with people, building a relationship, looking at them psychologically, emotionally, physically, spiritually. We're emphasizing less gluten, less dairy. A lot of these foods are really involved with hidden and delayed food allergies. So we're really trying to help people with an anti-inflammatory diet, which is one of the major causes of illness and disease. The more fruits and vegetables, emphasizing the fruits probably more berries and cherries because they have less carbohydrates in them and less sugars and less effect on for diabetes purposes. Garlic and onions would be great. Broccoli, the cruciferous vegetables would be really powerful. Nuts and seeds would be really great. The great thing about nuts and seeds is they're really healthy, especially for people that have more vegetarian, vegan type diets. You're going to get a lot of the omega-3s with the nuts and seeds. One of the things that's really important is to emphasize the less exercise a person does, the less carbs they should eat. The Amish, for example, walk 14,000 to 16,000 steps a day. They don't have diabetes or obesity because they do so much exercise. Carbohydrates are not evil. There's only three foods, fats, fibers, and protein, that we get calories. But it's just that we oftentimes use that as a replacement, and I think a little bit more emphasis on proteins and healthy fats would be good. But packaged processed foods, I think we should cut down on those, and the more from scratch that we do, getting back to basics. I think about, I joke with my patients about being honorary Amish. I really think we need to get back to a lifestyle more of better sleep and less stress and more working together in community. We've had a huge downfall in our health in the last 50 years in the United States. Many people are eating healthier, but the overall population is eating worse. And so the more from fresh, the more from scratch you can do, the more organic that you can do, and just really taking time to digest your food. Gluten is comprised of wheat, rye, barley, spelt, and kamut, and it is really dominant in our society. Most Americans eat it 3 times a day without realizing, and even when they're not eating bread, it's found in other packaged processed goods. We really recommend as a naturopathic doctor to get away from this. A lot of people are allergic to soy, and just like they are to dairy and to wheat and other things, to citrus. So I don't have anything anti-soy, like there's a lot of people on the market that are anti-soy. I really believe we should do soy through tofu and miso and tempeh and the way that the Japanese eat it. They're the healthiest people in the world. We, as naturopathic doctors, we highly recommend organic. And of course, what's organic now is getting more and more complicated with so many different, rules and regulations and laws and various things. But whenever a person could buy organic, I would prefer that. If a person's not feeling well, oftentimes it's a result of stress. It's oftentimes a result of not sleeping enough. And it depends upon whether it's kind of an emergency type situation or whether they're not feeling well. And I would just say really take a look at your life and seeing if you're overworking, if you're overdoing it, if you're not sleeping enough, making sure you're drinking enough water. Sleep is essential to life. And really think about relationships and what's going on there, how we're treating each other, and sometimes just slowing down is really the best way rather than speeding it up and rushing around. And I find a lot of people that they're trying to live the perfect lifestyle, and there is no perfection. And anybody that attempts to be a perfectionist, attempts to do things perfectly, ends up usually with adrenal fatigue. And I oftentimes tell my patients, I would prefer that you forgive your brother than to buy a supplement from us, because I can't sell you forgiveness. I can't transform. That's a decision that you have to make. If your neurotransmitters are more imbalanced and your hormones are more imbalanced, they're more likely that you're able to have attitudinal changes. But really, attitude is 100% in our control. And that's the things that can really make a huge difference in our health. We can't control our genes, but we can control the kind of food we put in our body. We can control the kind of decisions that we make. Well, the run is 3,250 miles across 16 states and through Washington, D.C., and it's a run to move natural medicine forward. It's really a chance to raise public consciousness about naturopathic doctors, about natural medicine, and really to help produce a healthier America. 30 miles a day, and it's for 4 months. And we take a day off every time we reach a city. So it's a pretty intense, but the whole idea behind it is to generate media excitement in the media, because the way I figured and the way the media has looked at these other events, if a person is willing to put their practice and their body on the line, maybe we should listen. Maybe there's something to this, because you don't see pharmaceutical reps running across the United States. And if you live anywhere, cities along the way, it would be great if you could contact us and let us know how you can get involved in those particular events, because we'd love to see you at those particular towns as we come through, and any organizing we can do, and we'd just love to see you.
There couldn't be a better city to start out and to run across the country.
10 miles down, so we have only 3,240 to go.
York, here we come.
York.
Yeah.
In recognition of Dr. Godby's commitment to natural medicine, the City and County of San Francisco Board of Supervisors send their best wishes to you on this special day.
3, 2, 1.